sure. Just okay, we good?
If the button didn't come on,
Okay,
though.
after major, well, there's light, so we're good. After major storms or natural disasters affect large communities of people, the news will generally send out messages asking for more blood transfusion, more blood donations that will be used to help the medical procedures that are going to be performed on the victims. Our blood is our life, and as such, without it we cannot transport oxygen to our other organs and we will die. So, when we get ill or natural disasters befall us, something has to be done. However, blood transfusions are not always the best option. There are alternatives that can be considered instead of blood transfusions. We all have the responsibility to take care of ourselves mentally and physically when our health is affected. Blood transfusions are not the only option available to physicians, and I'd like to persuade you of the need to consider alternatives. There are many reasons that other people opt for bloodless surgery, namely for their faith and religious beliefs, as well as out of fear of contracting diseases such as hepatitis or HIV. However, studies have shown that no blood surgery can lead to a faster recovery rate, is safer for the patient, and leads to a shorter stay in the hospital. Whereas blood transfusions increase the risk of complication and reduce the survival rate. Surgeons are often finding alternative means to blood transfusions in major surgeries such as heart, hip, and liver transplants. Experts say that it is safer for patients and will help avoid a looming shortage of blood as more people contract diseases such as cancer and need orthopedic surgeries. Australian Red Cross Blood Service Transfusion Medicine Specialist Lynn Ashton said Australia had one of the safest blood supplies in the world, but it was not risk-free, nor was the practice of people using their own pre-collected blood. We will always need donors, but demand keeps increasing, and our rationale is that we should be giving blood to people who need it, but if there are safer alternatives, they'd rather use those. Another benefit of bloodless surgery is the cost involved. In a study written up in the article Liver Transplantation Without the Use of Blood Predicts, published in May of '94, showed that in a compare and contrast with the results of liver transplant patients after surgery, some patients used blood and some patients didn't get blood transfusions, the mean charge of the bloodless surgery was $174,000, in opposed to those who didn't use that was the amount of the patients that didn't get the blood transfusions, whereas the comparison patients was $327,000. Surgery undertaken to reduce blood loss in patients and replace the blood with blood fillers, or having patients prepare their bodies by increasing their red blood cell before surgery, reduces the risk of contaminations and complications arising from incorrect blood typing. Receiving blood that carries disease and safeguards the consequences of many to whom blood transfusions are unacceptable or non-negotiable. Bloodless surgery has benefits far outweighing the use of transfusions. We're responsible for our bodies and health, and each of us will be paying for the procedures that are performed on us, both physically and financially, for years after. I hope to have motivated you to take a more active interest in your health and to research alternative medicine in the future. And now